Hello everyone, in this video we'll see the day 4 of our 15 days timetable. We'll cover all the important points under the day 4. For day 4 it is a 6 hours timetable. We have 6 topics, 3 from general medicine and 3 from ortho. So infections, endocrinology, hematology, GIT, liver and kidney. And for ortho, growth and development, cleft lip and palate will be covered both from oral surgery and ortho point of view. And lastly, development of dentition. So first topic, infection. Infections, we have already gone through the antibiotic topics earlier. So you have to brush up all the things which you studied in antibiotics. Along with that, you have to cover the infection as well. So you have to read classification, mechanism of antibiotics, Jarisch-Hershkimer reaction, aminoglycoside toxicity, adverse effect of chloramphenicol, tetracycline, what is an acticide, antidox, anti-tubercular drugs and adverse effects, antiviral and antifungal drugs. These are things which you would have already studied when you studied under antibiotics. Apart from that, you have to read about Clostridium infection, tuberculosis, hepatitis, HIV, herpes group of viruses, the DNA and RNA viruses, just the name alone, syphilis and candidiasis. Under endocrinology, you have to again brush up all the physiology point of view. From general medicine, what is the difference which you have to add on here is all the pathology associated with it. So when you are studying a calcitonin and parathormone, make sure you go through the features of tetany once again when you are reading the general medicine part. Same thing applies for adrenal gland and hormones, the aldosterone, you have Conn syndrome, Cushing syndrome. So everything, when you study the physiology, I mentioned the general medicine part as well. So this is going to be a brush up of your physiology part of endocrinology, of which you have to cover mainly the calcium homeostasis, diabetes, and then the adrenal cortex hormones pathology part of you. Then under hematology. So hematology, as I have mentioned earlier again and again, it is a very important topic. So it is a complete revision of physiology what you studied in hematology, and from general medicine point of view, the diseases of blood, especially the anemia, leukemia, bleeding and clotting disorders, and the clotting factors and issues related with it. This is very important from hematology point of view. And the next topic, gastrointestinal tract. The same thing under physiology, but the special feature what you will be adding here is peptic ulcer and jaundice. So these are the two pathological point which is very important from exam point of view, which you have to cover from the gastrointestinal tract topic. And the next one, under growth and development, you have to read about Scammonn's growth curve, cephalocaudal gradient of growth, theories of growth, pharyngeal arches and pouch and their derivatives, functional matrix theory and the components of them, what is drift and displacement in bone growth, the growth spurt and the growth center, and what are the types of synchondrosis. Next topic is cleft lip and palate. Is a very important topic. So you have to cover the embryology part of the cleft lip and palate, that is the formation of palate, face and lip. Then under cleft palate, you have to know the classification, mainly the Kernahan stepwise classification and view classification. What is Peary-Robin sequence or Peary-Robin syndrome, then the rule of 10 applicable for cleft lip palate, what is nasoalveolar molding, and the management of cleft lip and palate is very important. So this tableau column you have to go through, at what age of the patient, what type of treatment you do. So the nasoalveolar molding usually comes under the pre-surgical infant orthopedics, that happens at 1 to 4 weeks of the patient's life. Here you have to know the bone grafting at what age you will be doing. So primary bone grafting what age, and secondary bone grafting usually at what age you will be doing. And lastly, any revision surgery at what time you will be doing. These are the questions which might be asked from MCQ. So you have to know at what age of the patient, what type of procedure, whether it is surgical orthodontics or a proper orthodontics, what age you will be doing the orthodontic treatment. Next, lastly, the last topic, development of dentition. So development of dentition, again, from tooth morphology, we would have studied the chronology, calcification, eruption stage. Apart from that, you have to know about the spacing, what is physiological spacing, what is the simian space, what is leeway space of Nance, what are the terminal planes, that is the classification of primary molar and the molar relation for permanent molar, then what is an ugly duckling stage, what is incisal liability, and what all will be there to tackle the incisal liability, what is self-correcting malocclusion, what all comes under it, then lastly the Nola stages of tooth development. Thank you.